I also have now developed an interest in aortic valve disease. I co-run the TAVI program, which is the percutaneous aortic valve program, which I'll explain in a moment, with my colleague, Mr. Birdie, who is working with sutureless aortic valves, two new technologies in treating people with aortic valve disease. The TAVI program is an opportunity to do aortic valve replacement through a minimally invasive route through the leg. At the moment it's in its first incarnation and is licensed for people who are too high risk for open surgery. And the reason for that is that there are slightly higher risks associated with doing it at the moment because it's a new technology and we don't know the durability of the valve, although we have seen data out to 7 years so far. The Germans are now putting it in people who have moderate risk of surgery as an option, and I think that over the next 2 or 3 generations, over the next 5 or 7 years, we will be replacing a lot more valves through the leg without needing the fact for the chest to be open. So the procedure is very interesting. It involves making a cut in the leg and passing a whole valve, a wire all the way up into the heart and then crossing the valve, and on top of that putting a balloon through, opening the balloon to fracture the valve and break away the calcification, and then pass the valve all the way up and then inflate it under X-ray control. Usually the inpatient stays between 3 and 5 days, although some of my colleagues have managed to do overnight stay cases, and this really is a great growth area. Unfortunately it's a very expensive procedure and therefore at the moment it's quite restricted in the health service, but I suspect it will be an area of great growth, and it's a fantastic opportunity of developing newer technologies in heart surgery through a minimally invasive route.